So, after learning about the fatality of this absolutely lovely virus, let's talk about some of the beginning stages of it. After a rabies exposure, the virus typically travels to the brain through the central nervous system. And this process is known as the incubation period, which refers to the time between exposure and the time of appearance of symptoms. And this process can last for weeks to months to sometimes even years. So sometimes what will happen is somebody who has been infected with rabies won't even know. There have been cases of people who have hosted this virus for up to 2 years without any sort of symptoms appearing. And this incubation period is usually dependent on the location of the exposure site, which makes sense. Generally, exposures that are closer to the trunk of the body are faster acting. The viral strain, some strains of rabies are more virulent than others, and any pre-existing immunity that the host may have acquired before the exposure. And a diagnosis is usually performed with a tissue sample from the nape of the neck, and it is known as the direct immunofluorescent antibody test. However, this test is not always reliable in early stages, so generally it's advantageous to perform multiple tests in order to fully confirm if somebody has acquired rabies or not. All right, this is your signal to go to the next slide, which is all about the rabies timeline. Generally, when somebody becomes infected with this disease, they develop one of two types of rabies, which are characterized by the clinical manifestations of this virus. One of these manifestations is known as furious rabies, which is characterized by hyperactivity and occurs in 80% of human cases. The other manifestation is known as paralytic rabies, which is characterized by paralysis and occurs in 20% of human cases. So far, there has been no genetic differences that have been identified within the virus to explain the two different manifestations of rabies, but it just simply is. The clinical presentation of rabies can vary substantially between patients, which makes diagnosis on the basis of observed symptoms problematic. In individuals with furious rabies, hyperactivity manifests during the predominal phase and can alternate with confusion or agitation once the patient enters the acute neurological phase. In patients with paralytic rabies, during the predominal phase, the patient is fully alert, but confusion or drowsiness can intermittently occur during the acute neurological phase, although not as predominantly as seen in the furious form of the disease. The course of clinical disease and some clinical manifestations can be observed in both paralytic and furious rabies. Thus, it is generally not possible to differentiate between the two forms until the acute neurological phase. The average time from the onset of symptoms to death is 7.8 days in furious rabies and 11 days in paralytic rabies. The clinical manifestations for rabies during the predominant phase, which is the beginning phase of any sort of disease, are as such: fever, pruritus, which is the medical term for itchy skin, or pileoerection, which is the bristling of hairs due to involuntary contraction of small muscles at the base of hair follicles. All of these symptoms can be related to aggravations within the central or peripheral nervous system, which is strongly affected by the rabies virus. Although there are many signs and symptoms associated with the acute neurological phase of rabies, I just want to focus on just two, just because I think that they're so interesting, and those are hydrophobia and aerophobia. Hydrophobia is the fear of water, and aerophobia is the fear of fresh air or drafts. So the reason why one develops the fear of water or of air is because the infection causes intense spasms in the throat whenever a person tries to swallow. Even the thought of swallowing water can cause spasms, making it appear as if the individual is afraid of water. Similar reflexes can be elicited by airflow, which causes airphobia, and other stimuli like noise. These symptoms are caused by destruction of brainstem neurons. This is often why patients with rabies die from dehydration rather than the virus itself, because they absolutely refuse to drink any sort of water. Following the acute neurological phase, the infected individual will then fall into a coma and then die within a week. This entire timeline from first symptom until death usually takes 3 to 14 days. RIP. This is your cue to go to the next slide, which talks about the epidemiology of rabies. So the most affected populations are populations that reside within Africa, Asia, or Latin America. And this makes complete sense because there are just simply a lot of stray dogs in these areas. So therefore, there are a lot less dogs that receive the rabies vaccine. Also, people under the age of 15 are far more likely to become infected with rabies. This is due to the fact that they're kids. They're uneducated. They don't know about the dangers of rabies, and they want to go out and play with some dogs. And, you get bit by one, you get rabies. Also, a lot of people within these areas don't have access to the PEP vaccine, which stands for post-exposure prophylaxis. And it is essentially a shot that is injected to the site of exposure. It works best if it is administered within 72 hours of exposure. So if you don't get to a doctor within 3 days, you're probably going to die of rabies. For travelers, a lot of single-dose vaccines are available, and it gives 2 years of immunity against rabies. Finally, this virus is spread through direct contact transmission, usually a bite or a claw mark to the skin that can pierce the skin. And there is no intermediate host, seeing as this pathogen can have its entire life cycle within a singular mammal, the most popular being dogs, bats, or humans.